Maybe I'll start with a little bit about myself. I'm a physician, I'm an internist, infectious disease doc, I'm a health services researcher, and I'm a technologist. In fact, I began my career not even realizing that technology would be so relevant, but in 1988, I was a computer science major at the University of Michigan. My thesis was AI in healthcare. So I was thinking about this for a while. But okay, I wouldn't clap too much because there really wasn't a whole lot of AI in healthcare. A very short thesis, but a lot of creative hallucinations or confabulations. And I found that I was really just thinking maybe out of the box, but I wasn't anticipating all the changes that would occur. And we have seen some dramatic changes over the past decade, and more particularly the past few years, specifically with the evolution of AI going from AI ML, which is I'll call the traditional AI, to then starting to leverage the deep learning neural networks to generative AI. And now within generative AI, it's more than just simply predicting the next word or the next pixel. It's actually tapping into vast amounts of knowledge and extracting it, presenting it in a way that people can utilize it, and democratizing it across an entire world through a natural language interface. And that's the reason why ChatGPT is the fastest growing application in the history of the internet. I think many of you are familiar with Instagram, Google, Yahoo at the time. I'm faster than all of those. And it is surprising because what we're seeing is it's continuing to get better and better. And so what we're now recognizing is that in order for us to be able to apply these newer technologies in the industries, we actually need to translate business problems into things that technology can address. And while Microsoft and a lot of these other companies have incredible technologies and expertise in the technologies, they do not have a lot of understanding of what those business problems are. So in the clinical space, there are a lot of problems. And having been a practicing clinician on faculty at UCLA and at Cedars-Sinai and the VA and working in other areas, I saw it firsthand. And now working closely with providers, payers, pharma, med tech, life sciences, across the board, we see that there's so many different problems, all of which have unique challenges as well. And so we can't just take a general purpose technology and apply it to these areas, which I'm sure all of you know. And so they need these translators. And so I work very closely with the clients and partners across the globe, ultimately to figure out how AI and other technologies can be used to improve upon their outcomes. And so that's a really exciting area and an opportunity for us to start thinking about how AI can be a transformative agent. And I'm working with large companies, medium-sized, and also small. And as we start looking at the small companies, startups, we recognize that the amount of innovation that occurs within that space is far greater than the amount of innovation on the big company side. And what we also collectively, and what we also recognize is that there are a lot of limitations. And in addition to all the things I mentioned, I'm also an entrepreneur who early in my career, and this is how I got to Microsoft, I was a co-principal of a startup. And at that time, I can tell you, like many of you, and we were just having a conversation earlier, it's difficult because you're wearing every single hat. You're the product development, you're the sales, you're the person pulling all the funds in. And it's really hard for a small, under-resourced organization to be able to do all the things that are necessary to grow the business. And so that is a challenge. But when we think about where we're allocating funds, it has to go into a lot of the infrastructure. Things like making sure the data is secure, making sure there's a lot of cyber attacks out there, making sure that it's HIPAA compliant, making sure that it's interoperable, making sure that it actually leverages the latest and greatest technologies like GPT, as opposed to using older models. Because if you're not doing the latest stuff and you don't have those protections, no one's going to buy it. And so that is a challenge. And what we realized at Microsoft was that that's stuff that doesn't have to be done by the startups. And so our objective is really to provide a level of infrastructure that enables every company, whether it's small, medium, or large, to be able to do more. In fact, that's our mission. Our mission has changed. It used to be about putting a computer on every desktop. It's now about empowering every individual and every organization to be able to achieve more. And we do it by leveraging the technology. So let me describe the technologies. Sometimes people think of it just as cloud and AI. Well, it's kind of a nebulous concept. Well, it starts at the most basic level of the data and understanding how you can secure the data and ensure that it's protected against all the cybersecurity attacks and things of that sort. The second layer on top of that is enabling us to be able to take the existing knowledge that we have within the industry and building those capabilities. So with healthcare, it's HIPAA. With life sciences, be GXP compliance. I mean, there's a whole series of mechanisms that we recognize that have to be built in. And then it includes interoperability and fire compatibility, now integration to existing systems. And if you're a startup trying to integrate into the EHR, if you're trying to integrate into existing larger systems, it's really tough to get people's attention. It's better to leverage an existing channel, which we have already built the paths for. So that's a critical part that you don't have to take care of. So you don't have to worry about the cybersecurity elements. You don't have to worry about that other layer, which is the very industry specific. And then you get to the real exciting stuff, the AI, the generative AI in particular. And as we think about the generative AI, we have now an ability to do things that we could never envision before. I mean, we've been talking to pharma and life science companies. There was a model that they had built in traditional AI, ML, and high performance computing. And it took them many, many years to create a partial fold. And they were wondering, based on their current rate, it would have taken them another 1,000 years with existing high performance compute to complete the complete fold. It actually took them a matter of months with the generative AI. That's the power that we have with this amazing technology. And we're seeing it right now being applied in clinical practice where doctors and other nurses are now being able to just talk to the patient and it's captured and it's seamlessly brought into the medical record. All what used to be science fiction is all real today, largely because of the advancements we're making. And so we're now recognizing that this is an incredible tool. Let's leverage that. And you don't have to build it yourself. You can take it out of the box. It's part of the package. And then we stop. Microsoft goes maybe 60-80% of the way on the stack. The rest of the 20-40% is all done by our partners. And our belief is that the only way we're going to solve the problems in healthcare is through a very large ecosystem that is supported by large partners. And so how do we support you? We have a program that's called Microsoft for Startups. And Microsoft for Startups is designed specifically to encourage organizations to start leveraging cloud. So, taking advantage of the Azure credits so you can actually get going. But more importantly than beyond the technology benefits that you can get, everything I've talked about, there's an opportunity to work within Microsoft and its partners to leverage our entire ecosystem. Every major country, healthcare key players, whether it's on the provider side with electronic health records, whether it's certain sides on med tech, pharma life science, all of them have existing infrastructure players that you have to somehow find ways to integrate into. We can help you co-sell into it. We can create marketplaces for you to get exposure. And it's a lot easier when organizations say we're going to bet on Microsoft. And oh, by the way, there's a large number of partners that can be flipped on if you're interested, as opposed to trying to break through the doors yourself. And so that's really what we want to do. We want to make you successful. So my goal here is to let you know what we have. Martin mentioned Sally Frank. Sally runs our program called Microsoft for Startups. I would highly recommend that you take a look at that. It's you can just look it on the website. There's a form you can fill out, and you can get enrolled. You can enroll very quickly. It's a fantastic way to start. And I'm here for the rest of the day to answer any other questions. So I want to thank you for your time and look forward to the rest of the program.
Thank you very much, David. I would just like to invite Ben. Ben is actually going to introduce to the president of CBSM.
Thank you, Dr. Rhew, for sharing that framework and those insights. Now we'd like to invite Tom Meal. Is he here? Tom has a very distinguished career in working with a lot of different investment banks.
You're way too kind, thank you. Thank you, Deepak, for including us in the keynote forward. Thank you so much. I just wanted to spend 2 quick minutes and let you guys know what we're up to at the club, specifically related to entrepreneurship. About 2 years ago, we launched a group called Columbia Angel Network, affectionately known as CAN. Has anybody heard of it? 1, excellent. 2, yes, this is part of the reason why I'm here. We've been here for 2 years, and we have about 500 people that follow us on the website and through other channels, but Specifically, it supports the ecosystem of Columbia founders and entrepreneurs. It's not just the business school. I think there's 19 or 20 different colleges across the campus. Any entrepreneur that's tied to Columbia, we would love to have you, check out our group. There's a few things that we do. The most important one, I guess, is next Tuesday evening. DL Paper is hosting us. We run quarterly Shark Tanks. So every quarter, we get 40 or 50 companies that are all part of Columbia. We pick 3, and they pitch to a group of investors, and we try to raise capital for them. It's not like we're going to raise millions of dollars. We typically raise anywhere from, on the low end, $25,000 to the high end, maybe $250,000. So it's not going to change your world, but it's a great way to at least start raising capital. The networking effect of our events, I hope, are similar to what's going to happen here tonight and beyond. So it's a wonderful evening. Plenty of wine and cheese. And for the founders in the room, one of the other things we do for the club through the club is lots of times people are just getting started with raising capital. One of the things we offer any founder is the opportunity to pitch to the council, as we call ourselves. There's no titles or anything, we're just the council. Pitch to us. We'd love to give you feedback on your presentation, not only in how you deliver it, but the actual materials you're using. And we found to be very, very effective in making the presenters just more effective at successfully raising capital. So that's all I wanted to say. Any questions that someone might have I could answer? Good, well, the last thing I'll say is that we promise not to stalk you, but you're probably all gonna get an email at some point in the next 24 hours just to invite you formally to our event. We hope to see many of you there, so thank you.
Thank you very much. So, thank you very much, David. And somebody actually told me, this was actually a question asked to one of the EHR company head, that how you actually handle the data interoperability. The answer, without actually naming the person, I would basically say the answer was that when everybody is on my platform, then there is no need of data interoperability. So I think so good to see actually that there are parties, Microsoft is actually thinking of data interoperability and then putting that infrastructure together itself also. And I mean, there is a lot to come from OpenAI. It just has started. So it just started, and the conversation goes actually from how you jailbreak it and then don't actually get into the Twitter, somebody posting that, okay, how this actually, you break it. But I think there are a lot of things which actually entrepreneurs can do, what basically David mentioned, 20 to 40%. That is actually a lot of value. I would basically say, please pay attention to that. And many of you will be actually doing that already. So with that, I will actually start the panel. I will invite actually panelist, panel members, Dr. Martin, Dr. Felix, also Michael Bolton, Ping Ye, and Matthew McMahon. I might actually just go to the side. Love to. So how many of you love New York City? I'm so glad. I think I've seen actually a hand from a person who is from Atlanta. so actually there's no city like New York City. I love actually. With that also, I would basically say that I would like to introduce myself. I'm Deepak Mittal. Sorry if I'm introducing myself twice because I did already. So I'm actually the chairman of Healthcare Committee of Columbia Business School Alum Club, and also the CEO of NextGen Invent. NextGen Invent is a technology and data science services company. And with that, I would actually like to let actually the panelists introduce themselves to the audience. First, I will actually say Dr. Martin Gresham. He is actually the managing partner and CIO of Endeavor Venture Funds. Matthew McMahon, who is actually the director of NIH Seed. Felix Lee, who is the US Digital Medical Head of Sanofi. Michael Boughton, who is actually the CHIO, which is actually CMIO.
They're the same thing.
New York City Health and Hospitals, Ping Ye, who actually has come from Minnesota.
I love New York too.
Who is actually the CEO of the Roxy. And we basically have chosen this panel because you will see the breadth from finance to government sector, to the private sector, to actually the non-profit organization as well, and also the entrepreneurs. So the view from everybody will be actually be very useful. With that, please, we'd love to actually, you can introduce yourself to our audience. I would appreciate it.
That's the hardest part of it, usually. Turning the microphone on. Can you hear me? So first, again, I really want to thank everyone for being here. It's a tremendous combination of skill sets and interests and passions, and that's, I think, what we're going to highlight here. So my background is a little bit of that. So I started out as an FDA attorney. I thought I was going to save the world. I'm doing my best to still do that. And then along the course, I did get an academic background in public health and healthcare economics. And in this course, I saw how important it is to be able to combine different skill sets. And so I took the leap and I got my medical degree. I'm an oncologist and immunologist. I did some neuroscience, basic research as well. And then in the course of this, I saw all kinds of wonderful things happening in medicine and science and technology, and I got inspired. I got inspired and I did a startup, and then I did another startup, and another startup. And these were all patient-focused, patient-centered, patient-facing, because the patient experience really was not so great 20 years ago. It's improving, and the digital landscape and the digitalization of healthcare is improving that process. So I then went on, and through these different startups, I transitioned into running a finance organization. So it was a hedge fund. I know I say that cautiously. It was a good hedge fund. And then that morphed into Endeavor One, which was launched in 2009, very much focused on biotechnology, very much focused on how can we bring technology to create change. I'm proud to say that we were one of the investors in Moderna. So maybe all of you have a little bit of our product in you. Sorry for the Pfizer person here. But that morphed over into 69 investments. We exited that and then brought that forward into our venture studio and our Series B fund, which brings me here to the digital landscape and working with companies, like Microsoft, who represent incredible opportunities to integrate really amazing new technologies, is what this is all about. So thank you for letting me kind of spread the gospel, because maybe I still have a little bit about Save the World in me. And that's, again, a catalyst to everybody out here to kind of speak to everybody here afterwards. You would like to know.
All right, I guess I got the microphone. So I'm Mike. I'm a practicing emergency medicine physician. I got into the whole healthcare IT landscape infrastructure completely by accident. For residency, I wound up at one of the preeminent places in the world for healthcare informatics, and I proceeded to have zero contact with the group the entire time I was there. I had no interest. I was interested in being a clinician. I was interested in operations. I was interested in finance. I was a little bit interested in academic, but that was killed pretty quick. I still write book chapters by mistake more often than I'd like to admit, but it happens. The reason I say that about not wanting to be involved with tech is that I don't think that's the main driver of things. Like when you're working in healthcare, you want to stay patient focused, and a lot of times people lose focus on that. So when when I was first asked to be a chief medical information officer, I told them they had the exact wrong person. I had no interest in coding. I had no interest in all these kind of things because I misunderstood what these types of roles and these kind of interactions were supposed to be, which is actually looking to people like a lot of people in this room that are doing innovation and applying that to healthcare to actually drive patient benefit, to maybe give us some organs that we can actually go out and do more good for our patients with. So I changed eventually, I've done a very, very bad, I think I told these guys this before, I've done a very bad job at every stage of my career predicting what the next stage will be. I've prepped for a job and always gotten a slightly different job and been very, very happy about it. But I think being open to what technology can do to improve healthcare has been really my passion, and that's why I'm looking forward to sharing with you guys tonight.
Felix, you want to go next?
Sure. Okay. Felix Lee. So I just yes.
Continues to be the hardest part. Oh, yes, you're correct.
So I'm a pharmacist by background, by training, practice in the UK. I've had a bit of an eclectic journey. I've spent 20 plus years in roles that are around strategy, innovation, more now towards transformation, in different areas, inside healthcare, outside healthcare, and it's been a journey that has taken me into building up new business models, build partnerships, build investments in healthcare, and then into building products and services. I've been 9 years now in Sanofi, so as you know, a very big pharma company. I started working along the continuum of drug development from the commercial front, from early stage all the way through to lifecycle management. But in the past few years, I've become fully dedicated into digital health, which in my role is actually something completely away from drugs, which is not very usual or common in a drug company. And so I work on patient-facing digital solutions that are drug agnostic, that help improve the management of chronic conditions. And we do that by partnering. We work with innovators out there. We run partnerships that help accelerate growth. We work on things like commercialization, enhancing product features in development, in evidence generation, in order to prove value to the different stakeholders, the payers, the physicians, etc. And I've also been fortunate along this journey to have worked in different, on different sides of the healthcare ecosystem. So from the payer provider side, to the investor side, to the drug development side, and also in digital health.
Great, thanks. I'm Matt McMahon. I'm the director of the SEED office at the National Institutes of Health. And many people know that and think of NIH as the largest funder of basic biomedical research in the world. But what most people don't realize is that we're also the largest seed stage investor in small businesses in the United States. So we're spending $1.3 billion every year in totally non-dilutive investments in around 1,500 small businesses across the United States in the healthcare space. And the reason that we do that is because the vision of NIH is not just to understand the basic biology of human experience, but also to apply that knowledge to the betterment of the human condition. And so what we've been trying to do over the last few decades is really build a comprehensive pipeline that can take those basic science discoveries and at the earliest stages help those innovators turn a science project into a product development project and give them the tools and the resources to do that. So that's not only funding through the SBIR and STTR programs, but it's also wrapping around entrepreneurial and business development services around that funding so that we can really position people to move those technologies into the private sector where they can make their way all the way to the healthcare environment and really affect patients. So my personal background, I was an ophthalmology and vision science person for a number of years. I was the principal scientist for a company called Second Sight that developed a bionic eye. But right before Second Sight got FDA approval, I actually moved to DC to work as a science and technology advisor in the Senate. I spent some time there, went over to the House of Representatives and spent some time there as a science advisor. and then made my way to the National Institutes of Health. And so I have kind of a broad background that helps me be able to come up with ways and lead a team that can really help bridge that gap between the way scientists think about their discoveries in the laboratory and what they're going to need to know, and the relationships they're going to need to build, and the steps that they will need to take to actually turn those discoveries into something that's useful. And we have a really good track record of successes in that area, and we're doing more and more and developing more relationships in the investment world. We have a formal relationship with the Angel Capital Association. We love to attend events like this. We're trying to build an ecosystem that really enables people to be successful and to take more of those discoveries and actually turn them into things that help patients.
Hi everybody, Ping Ye, the Minnesota guy. I love New York. A lot of fond memories. 30 years ago, I actually performed at Lincoln Center. The old official area. Any musicians out there? Now Geffen, I believe. Yeah. Okay, so a little bit about my background. Tech, actually, nanotechnologist from UC San Diego. And I spent the first 15 years of my career in tech for companies like Seagate, Samsung, Dell, moving a lot of technologies that are in data centers and all our phones in the world. So that was crazy, but I moved up the stack. So from nanotechnology into hard drives and solid state, and then into data centers for Dell. And then about 11, 12 years ago, was diagnosed with blood cancer, Hodgkin's lymphoma blood cancer, which changed my life tremendously. And when I went back to work, I didn't feel the same passion for putting more exabytes and petabytes and all that stuff. And so I formed my first company, which industrialized human brain organoids. Totally random, but it was my experience in cancer. I was actually resistant to cancer treatment for Hodgkin's lymphoma, and I had to do all different types of crazy treatments, which was very toxic. So I was actually quite lucky to survive that. So why the first company was about creating better human models to discover what drugs might work for people better. So that's kind of how it started. And so I guess now I'm a serial entrepreneur. I helped get a couple other companies off the ground, and now more recently, a couple years ago, I was advising a team at Boston Scientific, and they asked if I would take their technology and commercialize it. So a little show and tell. It's now shrunken down, but this is a mobile breathalyzer that from a minute of breathing captures a metabolic snapshot of one's body. And so we can relate those breath print patterns from one's breath and relate that to whatever group of individuals we're studying. So we're starting with lung cancer first. And so that's what I'm busy with. Thank you.
Awesome. This is actually a difficult part. I agree. So the question comes is that we all love New York City, and it's a great city, but what makes it great? I think I have my theory. There are 5,100 life sciences companies in New York State. New York State gets the maximum funding from NIH. They are actually the #1 in the talent when it comes to STEM and also the life sciences. Really the #1. And if you talk about universities, there are 120 plus universities. And there are more than 100 accelerators and incubators in this city. And Columbia is actually one of them, of course. So with that said, the question actually really comes to my mind is that what strategic initiatives are actually undergoing in your organization which promote innovation, entrepreneurship, and healthcare ecosystem? Anybody would like? And Martin, you would like to go first, or? Sure. You have the mic, so.
I have a mic. So thank you very much for that thought-provoking question, and I think it centers around how do we deploy capital as venture capitalists? Why do we deploy capital? What is the mission and the vision? And what are the resources here in New York that help accelerate that? So at Endeavor, we have what we call the diamond approach to investing. First is we need to find a CEO that is a leader. And that leadership skill set can be built out. We're fortunate to have an incredible director, Jenny Fernandez, who's back there, who's director of leadership and branding and communications. All these things are part of what it takes as a first step to build a great company. And I think you will find in New York City, there's many organizations that these young entrepreneurs can go to for feedback. So Deepak mentioned a little bit about what Columbia is doing. There's a number of other institutions as well. So that's the first point. The second is, how do you build out this leadership to create effective teams? One of the things that I find in being a moderator for many different events globally is there's a commonality from industry that says we want teams that can actually deliver what the CEO thinks they can deliver. So effective teams to be able to integrate their innovation into large hospitals and into large ecosystems, which we were talking about just a few minutes ago, is critical. And so building out those teams requires collaboration, and universities across the New York area certainly help in that. Right here, just a few blocks away, there is the Alexandria Life Sciences Center, which is now backed in part by the Chan Zuckerberg Foundation, and we are participating in that. That signals one of the things that I think is very, very important for us at Endeavor. It's important for us to recognize as investors, where is the money going? So what is the liquidity channel? And I urge you all as young entrepreneurs to think about that. It's not enough to have great innovation. It's important to have partners. And that's what this evening is about, finding great partners. And New York is a hub for that. One of the motivating factors that Deepak and I thought were very important to bring to this event was the notion that there is a hub here in New York. We are working also with important organizations like the New York City Economic Development Corporation, who support really bringing in companies into the New York area, and hope to work more and more with NIH. I know that you're the biggest investor here. So. I think the other pieces, which I think, again, are centered in New York City, are great strategic partners. So Sanofi and Pfizer and Merck on the industry side. And then Mass Challenge, who's represented here by Ernesto, who I hope you all have a chance to meet. Trey Bowles from Techstars couldn't be here this evening, but as you probably know, some of you may know that I am a senior investor and executive in residence at Techstars, and we have a collaborative partnership with Techstars. So these are all things that are here in New York or in the surrounding community that young entrepreneurs can take advantage of. And finally, what's really important is liquidity. So in New York, there is a ton of liquidity. You just have to be able to tap into it. One of the things that's happening in healthcare is that organizations like Microsoft and Google are putting in $100 billion into the digital healthcare space. So we as investors, yes, we want to save the world, but we also want to find real growth, scaling, and commercialization pathways. So that's what I think New York has. It has Google Ventures that has 255 investments in the past few years. They have 55% of their entire venture team is healthcare. So what I say is that in the next 10 years, my prediction is New York will be the digital healthcare hub of the United States because of all these things that we're talking about today. And we will find a better way to project our voices.
Well, I don't know what I can add to what Martin said that is that will really add any value, but I think that from the perspective of NIH, we're obviously funding innovation all around the country, and the powerful nexus of talent, capital, experience that that exists in the New York ecosystem. I think that it's events like this that help to bring those things together, because we see all of those bits and pieces all around the country, but the ecosystems that are successful are the ones that are able to harness all of those individual pieces and facilitate the connections between those pieces to be successful. So you can see many different places where all of those bits and pieces exist, but it's a limited number of places where it takes a certain amount of vision and leadership to bring those things together, and I think that we will indeed see that happening in New York in the future.
So from the nonprofit healthcare system perspective on this, it might not be what all the early stage investors want to hear, but when you start to look at this, what I really want is to be part of the early majority. I would want to position my healthcare system to invest in technologies that have been proven to work, so I minimize my risk. Like that's our perspective, and I think that makes sense to everybody, but that's hard from the other perspective. So I think focusing as much as you can on what the actual value proposition is to the healthcare system or whoever you're selling to or partnering with is kind of, I think, the core part of this.
Hi everyone, can I actually ask the audience, those that are like founders, starting new companies, can you raise your hand so I know where to
Yeah.
look?
That's fantastic.
And so every time when I attend something like this, because I'm often the one in the audience, and I always want to see if there's a takeaway, and learn something. I think things and tools that have helped me over the years, there's the EOS system, I don't know, entrepreneur operating system. I think, show of hands of anybody who've heard of it, couple? Okay, so it's like 10% of the people who raise their hands. So from a strategy standpoint, that's a really nice way to take goals and visions that you have 10 some years out and breaking it into manageable, achievable chunks into like 3 months. So really highly recommend that. And of course, you probably by now, especially on the coast here, Lean Startup and Business Model Campus and all of that. So I won't cover that. But I was just talking with Norma earlier. You want to raise your hand, Norma? She's been advising CEOs for like 50 years, she was telling me, so we talked to her. But we were talking about how quickly technology is changing nowadays. And she had a really interesting insight, which is, it's not, is really focusing on what's changing every year. There's of course your vision, but right now with so much change that's going on in technology, how does that then influence your plan, right? And so that's something to think about. At Voxy, we think about in terms of what's going to help us get to where we want to go. We gotta find strategic partners. We have to have access to clinical partners that can give us access to patients, because we don't have the patients and they do. So it's about driving that for us. But it's also, for example, thinking about the fundraising environment. Last year, I've been hearing that last year was one of the most difficult fundraising climates of the last decade. So if that's the case, and you're all trying to raise funding, what's the contingency plan? And so there are things like, in addition to NIH, there are things with the Department of Defense, there's things with the CIA, there's with HHS and BARDA, and there's tons of opportunities out there. I think ARPA itself, ARPA-H, is getting $1.5 billion. And I had the opportunity to sit down with the director of ARPA-H yesterday at the Capitol. And so hearing their vision, I just highly recommend that all of you check out their site, because it's a different approach than the NIH way of funding. And so hopefully that's helpful to all of you.
And maybe just a quick note from the industry side. So I think especially when you look at big companies, right? So there are many different sources of potentially where you could have entry points to partner and either get financial returns or share the risk of developing new product. Right? And for example, for us we have a corporate venture arm, which many companies do, and that may be to help feed the pipeline of what is strategically important for the company in the future. And for example, we also have an incubator called Future for Care, which today is much more around in Europe, and we have centers in France and Germany, and in the future may come to the US. And then even inside the company, different business units, are looking out for partnering with different kinds of startups or people who have, advanced technologies, and then which is separate to people who may be in R&D, maybe looking at how to improve the efficiency and productivity of the drug research and development process. And even out in manufacturing and supplies, and another way of looking at how digital can help with productivity, and also minimizing downtime risks, etc. So I think there are, when you look at a potential company that you may want to partner with, maybe just go that level deeper into thinking about who you may best relate to. So that you kind of try to navigate your way into the right entry points, and because companies like us are so big, don't give up just after speaking to one person. That person has no clue what you're talking about, and it just means you may not be talking to the right person.
It's so amazing, actually, so many resources. I think I don't know half of those as well, so I think that's been very helpful. The regulations are changing. Markets are changing. Investors are actually changing with that. We talk about technology change, but how many of actually the companies using fax still? Can I see the hands? Maybe they don't want to raise hands. Okay. But at the same time, generative AI is, of course, it has changed how we basically work day to day and in the organization as well. If you don't have the generative AI or the AI word in the first 3 sentences as an entrepreneur, it's going to be hard to actually raise funds. Generative AI was actually mentioned 3,000 times in the 3,000 earnings report last year. So 170 deals were actually done in that. So definitely a lot is changing. And so that actually brings also from the DHNY perspective, which is actually how the Digital Health New York is actually getting funded. It will be very surprising to actually hear that the top companies, which are the areas which are actually getting the funding, is RX biotech is number 1. Then actually patient provider enablement. Before actually patient engagement is actually the last. Interesting. Women's health, mental health, these are actually the areas which are getting a lot more funding as well. So with that, all that said, that's actually what data is saying. But I really want to hear what you are seeing in day-to-day, your life, when you're actually talking to entrepreneurs. Is that what is actually fueling this investment momentum? So I would love to actually know from you.
So you're right, everybody's doing large language models, generative AI right now, and the vast majority of vendors that come speak with me are about that. And the vast majority of vendors we go with are actually neural network and machine learning and something that is not generative AI. I'm not saying it doesn't have a role. I'm not saying it doesn't have a future. I'm not like, I'm not saying I'm not a Luddite here, but it's not what's been proven. And so if it's not what's been proven, and there's so much more work we can do with the other tools. And so where I think AI or generative AI might factor in is building on some of the machine learning neural network stuff. So, this is very much, once again, from a healthcare hospital perspective, but when I want to figure out how to like make my workflow better, and you look at like CT optimization, so like doing diagnoses off the CT, well, not diagnosis, but to triage the stuff, to bring it up for my radiologist to read quicker, that's a neural network, right? Like, so no generative AI there. When you look at how do I make my claims better, right? Because revenue cycle is a huge area. That's machine learning. So I really listen when people are doing their sales pitch to me, and with us, and we're looking for partners. But I gotta tell you, I am somewhat, you guys have ever seen like the hype cycle about where things stand. And I think generative AI, most people think, is kind of at the top of the hype cycle. I do think there's going to be long-term productivity there. I just think it is about the use case, and it is about partnering with somebody that has a use case that works. And if you're going to come to me, I'd like you to have a use case that really works, and I would ideally like you to have done that with somebody else already. That last part is almost impossible. That very rarely happens. But yeah, no, I think I almost feel like so many people feel like they need to tell me they're an expert in generative AI or large language models, and I think it's almost off-putting at this point. It's if you're whatever you're good at, I'd love to hear what you're good at.
Okay. So first, I rebound on why I think patient engagement has the lowest level of investment. It's because it's the most difficult to commercialize. Who is going to pay for patient engagement? And that actually is, if I improve your workflow, you will pay me, right? So, and even today, if I go to a health plan and say I will save you money, they may not pay me because they will ask, when are you saving me the money, right? If it's within the next 2 years, okay, maybe I'll consider it. If it's beyond that, no, I think not. So I think one of the things that is tricky, especially from an investment perspective, is to look at the commercialization model. And in my area in digital health, it's not very well proven. You don't have a lot of successful cases. You have a lot of different technologies trying to make their way in, but they are based on products and technologies. They are not based necessarily on models that actually gets paid. And so I think we need to bridge that gap and really kind of, and I don't think it's any one side of responsibility, right? I always say digital health has no owner in the ecosystem. Everybody is talking about using digital health, but nobody owns it. It doesn't belong to the payer nor the provider. It's not like any other thing inside healthcare today, right? Providers with health systems, drugs with pharma companies, right? And so I think we really need to think about it in much more collaboratively in an ecosystem manner. If we can unlock that and figure that out, I think patient engagement is going to go up. Gen AI will probably have a lot of applicability in actually inpatient engagement. It will actually help save people from having to go to hospitals if we are able to leverage that well. So I think that is a bit tied, but I agree, Gen AI is too much of a buzzword. It's in every single conversation. But the key for me is finding the right use cases, because today it's not, the technology advancements are there. That is not the revolution that healthcare needs. Healthcare needs the revolution of how to implement it. That is not necessarily how we coin revolution, but this evolution is actually a revolution in healthcare.
So I just want to add on, to these incredible comments from Michael and Felix, and maybe with a little bit of a different perspective, because I sit in a different channel. I look at things in a temporal course. What's important in the here and now? And I think that's a lot of what you just heard. Like, what is important to hospital decision making here and now? What is important to large industry here and now? So as an investor, we break things down into a different cadence and a different kind of temporal course. We want to skate to where the puck is going, because we think that the return on that investment is going to be exponential. So we do want to address the concerns of the here and now, and we do that in some very specific ways. And I think recognizing, for example, what is really important to Microsoft, and their largest investment ever was Nuance at $19.6 billion. That's a statement, not only the here and now, but for the next 10, 20 plus years. As investors, we want to excite the entrepreneurs out here to recognize that there are these two different channels. You have to understand that your innovation is met with skepticism on a here and now practical level. You have to prove your case, and that's why it's important to develop really strong teams that know how to execute. So Michael talked about he'd rather work with companies that have already done it. It's really important to find collaboration partners, mentors, and advisors to help you get through that journey, and to build teams that really can execute and drive data. So we're very focused in this phase of finding strategic partners, whether it's hospitals or large enterprises, to do projects together. I don't like the word pilot, because for me, pilot is binary, like it's success or failure. Projects you can stack on top of each other. What I would also say is that skating to where the puck is going, like Wayne Gretzky said, that's where great players become seen. You want to look ahead, you want to be a bit of a futurist. And so what I see in Sanofi, frankly, is a futurist scenario. They have created Future for Care. How many people here know what Future for Care is? It's not in the American vernacular right now. But Future for Care is remarkable. They've put in over $1 billion into this program. There's over 50 companies that are registered in this program, and it's unusual bedfellows. Orange, which is a telecommunication company, Capgemini, which is a software development company, Sanofi, which has made a statement that they are now a digital health company, even though they make drugs.
Generali.
Thank you. Generali, an insurance company, have all come together to make a statement that they will invest in early stage digital first companies. This has been replicated now in Israel with Pfizer and other companies, Merck from Germany. So I think that as an investor, what I would say is what's exciting in terms of these trends is, first, it's critical to execute on the here and now. Sell your products based upon incredible teams that can execute and integrate, know how to integrate those services that are connected to your innovation into the hospitals, into the large enterprises, but don't lose track of where the puck is going. And for me, circling back into this digital hub in New York, where the puck is going is everything is digital. There is a digital transformation going on, plug into that. And as leaders in your company, know how to adapt. Know how to recognize that you have to address the concerns of Michael and Felix, but you also have to address my concerns, which is we want to invest in companies that are going to be 10, 20, 30x 5, 10 years from now.
Well, I would say from our team and what we do is mainly focused very early in the innovation cycle. And I would say the perspective that I can bring to this is that what we really like to focus on here is what is the unmet medical need? What is the clinical need? That's what drives everything. So, when you work with early stage innovators and NIH-funded scientists, you're working with some of the most brilliant minds who are making these discoveries, like groundbreaking medical discoveries every day in the laboratory. But transitioning those medical discoveries into something that's actually useful in clinical practice takes a mindset and requires training. So there were some comments earlier about like the lean launch pad and the business model canvas and the I-Core innovation core methodology. And I think as early stage innovators, as founders, it's really important not to lose focus on, at the various early stages of development, getting out there and using that I-Core methodology, a customer discovery methodology, to talk to people, talk to potential customers, and really, at the earliest stages of your product development, have a good handle on what value are you actually producing. So whether it's generative AI or machine learning or AI, I mean, that is the technology, that's not the product. So I think that from our perspective, we're trying to train innovators to bake that into their mindset from the very earliest stages. So in parallel with developing their technology, they're also developing the business case for that product at the same time. So by the time they're coming and speaking to investors or healthcare systems, they've already pressure tested that business case in the same way that they've pressure tested their technology. And that's the way that we hope the innovators we support will be successful.
So from an entrepreneur's perspective, can I first see the hands up again of the founders? And my question to you is, how many of you are, keep them up please, how many are raising your first round of funding and second round of funding? Also first round of funding again. So it's mostly first round. Okay, all right. So what have I seen? Last year I raised a little over 6 million, and I'll describe how that went. In my career I've done a little over 40 million, not counting getting onto the NASDAQ in that process. What I'm seeing on the entrepreneur side is that there is a lot of funding for early stage, actually. I'm seeing that. And I grew up in Silicon Valley, but I've traveled all over the country. And I'm seeing major cities, of course, have their angel groups. I think you have maybe the most of any part of the country. So I don't want to hear it from you, a guy from Minnesota. I don't want to hear about you don't have enough resources in New York because you're like swimming in resources here. So no complaining. So I think there are ways of funding. I think especially when it can be difficult in the early stages, it might not be with venture, it might be with family offices, it might be with international global fundraising organizations like Keiretsu. How many people know Keiretsu in the room? Oh, okay, so for those that don't know, Keiretsu is a global platform. It is pay to play to get in, and different regions in the world do more deals. So you have to you can talk to me afterwards, but can be a little bit more fruitful in what you raise. And most cities have their angel groups as well. So I would say that's what I'm seeing. And then had the opportunity to be at the Capitol the last couple days and hear really what's being funded. I concur. ARPA-H has a huge new initiative that, thanks for the nodding heads, yesterday they launched their effort for women funded one. So please check that out. But I think the other theme that I'm seeing is access to technologies or in rural and parts of the country, for example. And I'm seeing also, instead of sick care, the transition to truly health care is the other big theme that's been around for a few years, but I think it's really coming to light.
So many things actually. So we're actually running out of time also. So I think my key takeaway from what I have heard is that 1 + 1 is actually not equal to 2. It's 11. So that's, and with that, actually, I would request actually our panelists to actually give one takeaway which you would like to give to the audience. In short, and I think because we would like to give 15 minutes to kind of questions from the audience as well.
I think my one key takeaway I want to leave with you is, as you're approaching whether it is someone who may fund you or partner with you or buy your product or service, seek first to understand before you want to be understood. Know where the pain points are of who you're talking to, and then how potentially your product or solution may fit instead of being so passionate about telling someone about what you have, that you have not started the process of being with who you are with.
I say, unless you're Microsoft, Google, AWS, don't try to sell me on a platform that's going to solve all my problems, and anything that I bring up as an issue, you got. Tell me what you're great at. Like, tell me why what you can do, my people can't and shouldn't do. And yeah, that's it.
I think my single kind of message is become great leaders. That's really it. Build great teams. Learn how to be resilient. Learn how to adapt. Most importantly, find great strategic partners. And I completely echo what has just been said. Understand their pain points. This is about giving, not about taking. This is about your integration of your innovation to meet their needs. It's not about you pounding your chest that you have the greatest innovation in the world that's worth $1 billion. It's worth nothing unless it's picked up by large organizations that are going to commercialize it.
I would say two things. One, always stay focused on the patient and on the value that you're bringing. That's really the key. And also another thing, know what you don't know, and try and find a way to develop a network and find the resources to help you with those things that you don't know. Because that's really, the way to be successful is to be self-aware enough to identify those gaps and then be able to go out there and plug those gaps effectively.
I come from the same cloth as you in the audience as entrepreneurs. I'll say that after a decade of doing this, and then as an entrepreneur 15 years before that, I'll say that one of my favorite things I've heard is it's not about resources, it's about resourcefulness. And I have that on a post-it note on my door as I walk past it every day. I would say also, it's about, my first company, it went through the pandemic. It was very challenging and twists and turns, and often it's said that startups at least have 3 near-death experiences. So that's why you have to be passionate, because you're going to quit. And so that's why I love working with founders that won't quit even if they have no money, or they'll do it, like that. So I think one of the key takeaways around it is when does your thing, your company, your vision of what you're working on eventually die? And it's not so much that you don't have money, it's when it doesn't have the energy behind it. And so I think after doing this it will keep going if you have the energy. So the game is not over for what you're working on until you quit. The game's not over until you quit. And so, and you're gonna have that situation come up when bank account's low, the deal didn't happen, a gazillion things happen that are like near-death experiences, but what keeps you driving forward? And it's up to you. If you don't quit, it just keeps going because you're the energy behind it.
Great, I think we will actually open for the question and answer. But before that, just let me tell that after the question and answer, there are actually breakout sessions. So you can actually reach out to the people who are in the breakout sessions, and then you can, they can advise you, they can actually talk to you. We basically have in the breakout session David Rhew, who is the Global Chief Medical Officer. He's actually outside, you can see him. He was also a keynote speaker. We also have David Burgess, CEO of SUNY downstate. Could you please? Thank you. Medical Center. And we have Antonio Sanchez Cordero, who is the Group VP of Strategy and Business Development from Thermo Fisher. Great. We also have Felix Lee, who is actually US Digital Medical Head. You already know. And Michael Boughton. So you can actually reach out to them for the breakout sessions, and we would love to actually talk.
Is there some place we're supposed to go?
You basically, people will actually come to you who are. I think,
All comments.
exactly. So this was actually a discussion, and we basically had the rooms actually separate, but we found that it is very inconvenient for people to actually go out and then go into the conference room, and I would actually just say that, please take in this room. We can actually just have those 4 corners in one center.
5 corners in the square room.
With that, if somebody can actually help me passing the mic as well. Is there any question from the audience?
So maybe Ivan Strugatsky, Strength Capital and Hybrid Value. So maybe a question to Mike and everyone else. Kind of the dirty secret of the healthcare IT system is that 80% of the EHRs are based on the language which was developed 70 years ago and keep running, right, called mouse. So my question to you is, we are building on top of those systems new capabilities. Is there a risk that that 70 or 80-year-old backbone would actually collapse at some point of time? Particularly if we start adding generative AI and all that other fancy stuff.
So I think I mentioned that I'm not a coder, nor do I have deep interest in coding. So with that, mentioned his mumps is pretty flexible. At the end of the day, I don't think anything we're doing in healthcare is so fantastically complicated from a computing perspective with just the EHR that we need more than what the current vendors have. Now, would I like them to do things better? Yes. Would I like them to do interoperability better? Yes. Would I like better artificial intelligence to predict which of my patients have sepsis or which of my patients aren't going to show up for their appointment so I can use that time slot for something else? Yeah, but I don't think that the EHRs are what's holding me back at this juncture. When I started practicing at some of my facilities, and I'm not that old, they were on paper, like literally, and that's not that long ago. And so we've come so far in a relatively small period of time. I'd ask a coder, but no, I don't think it's a big risk. Anybody else?
I would just add to that is that you might actually find a lot of businesses still running on IBM mainframe. So, and at the same time, I think in the history, like if you talk about telecom, 2G, 3G, and some of the developing countries actually just moved to the new 5G, and then this passed. So if you go outside the US perspective, you actually will find there are many countries who doesn't have actually EHR being actually used. They might actually go for a better version of the EHR itself, which actually meet their needs. But at the same time, it's all about workflows, like Mike said in one of his comments. The people can actually build at the top of what is actually being there. Who would like to go next?
There was a gentleman.
Oh, sorry. A gentleman in the back.
Hi, thank you. Great panel and great topic. Excuse me. A comment, I guess, and a question, and I'd love to get the reaction of the experts up here in the panel. So I'm deeply involved in AI, both traditional, cult classic, and the new edition, generative AI. So, what I see happening, and that, I mean, horizontally, not this vertical, right, across the board. What I see that I think is attractive both to the founders and many investors is more better use of capital and optimization of limited resources. So if you think of what you could do with generative AI, as opposed to many of the traditional AI tools and approaches, is you could do a lot more, a lot faster, at a fraction of the money, and a fraction of the time. So it is new, yes. So I see that as really from a speed to market standpoint and attractiveness standpoint, people could do a lot more with a lot less money now, which I would think what I've seen makes it much more attractive to startups and the investors. Yes, with the anxiety that it's new, I get that. I get all that. So it's a double-edged sword. But the other thing I'd love to get a reaction on, just personally, and I am not a healthcare or biotech expert, but I have been a patient and I'm a father of 4 children. I live a half a mile from our hospital, and we're kind of frequent flyers over there over the years. And so a month and a half ago, I bought a pair of tennis sneakers on Amazon. Awesome experience. It was convenient, it was fast, it was low cost, and it was clear that it was a persona-based platform. They had all the data. They knew what I wanted. Did you want to buy the same sneakers as last time? Do you want to buy new? It was leverage all of, I would say, the cutting edge tech and customer experience. I took a child to a doctor a couple of weeks ago, and it was, I would say, the exact opposite. It was inconvenient. They asked the same question, the same time, 5 different forms, 6 different places. We were asked the same question by 3 different people, 4 different rooms. And so it seems as if all this tech, all this sophistication is much more advanced in retail and a B2C space than it is in the healthcare. I'm telling you what you already know. So here's the question. It's not here to be critical. We're all patients as well, right? I'm just curious, any of you have any thoughts or prediction as what's the next big bang? Knowing where we are, a lot of money, game-changing tech, big things happening, big players cutting big checks. Is there something truly transformative where a patient begins to feel that things have changed finally, that the things we're all waiting for? Curious if there's any reactions from the panel.
I'll match your comment with an anecdote. So I take care of patients in the emergency department, and whenever I ask them about their medical history, they just kind of gesture at the computer, like, go check the computer, it's in there. They don't care that they were seen at a different healthcare system that doesn't have the same consent relationships. And I think the interoperability piece is there from a technical perspective. Everyone just needs to get in line and actually share data, but there's market reasons where people don't want to share data, which is a problem. So I think you're starting to see information blocking come in, but it's really more information blocking regulations around doctors sharing with their patients and people keeping data with patients, not with the healthcare systems. So that would potentially be helpful.
Around what's changing, I think we all kind of came out of the pandemic, and I think that when I think about that, it's what shifted the patient behavior or our behavior, and I think it's wanting things that you normally get in a hospital but at home, which is why we wanted. So it's not really answering your question around AI, but it's looking at those major shifts to behavior, and if you look at the last several decades, whether it was SARS, MERS, COVID-19, COVID-29, right? I think those infectious disease events are going to be happening and kind of preparing for that. But the pandemic was, I think, for all of us, a big shift in behavior.
Actually, this will be the last question because we are actually running out of time. Just to add to actually the point which was made, I think if you probably know, follow the money. One record of a retail versus one patient record. Just compare the cost of it and losing actually one patient record and the penalty of it compared with actually losing one retail record. I think you might actually find the answer over there as well.
Hi, I am on the founder side, and thank you. You gave a lot of great insights. This is a growth partnering conference, and my question is towards that because that's what we're trying to do at our startup. A challenge that I see coming in from technology originally into digital health is that everything is bound by reimbursement codes. And it took us a while to get over that, find the right person, the right RCM expert, build a financial ROI model, can't do innovative things, right? Because not all payers may support that, so you have to go back to existing things. So I'm a bit surprised. I almost feel like there needs to be an innovation code or something like that. Because how do you get the best? How do you go down that efficiency curve, which we see in other products? There's no way to facilitate this. And I'm struggling a little bit, like even with the health systems, they want to first do industry-sponsored research. How do startups get money, right? To get money, they want data. To get data, we need to give money. And then I have the reimbursement codes, but they won't do a QI study first. It has to be an IRB-driven study. So give me some money, let me do the IRB study. Then we can see the codes. I think that's all backward, coming from the other side of the spectrum. And I don't know if this is ruffling any feathers, but I'm seriously, it's a burning question for me.
So we've been able to tackle your question because it's a big mess, and we're lucky to have some amazing resources in our network. I mean, one of them, in terms of reimbursement codes, just the reimbursement, insurance, acceptance, codes, like that whole path, it's kind of crazy. We work with United Health Group in town, because I'm in Minnesota and it's really close, and they're running, they're taking their data of, they have like half the US population kind of data, so they're running data and looking at our intended uses of our device and saying, okay, assuming that your device is used here, here, and here, how does that, is there clinical utility? What is the clinical utility for these different intended uses? So that's one way. And then they have, and then there are experts and consultants out there that do know that huge binder from the ANA, like the CPT code binder and all of that. So there are experts that can help you, go through that path. But I agree, it can be challenging, and I think you have to think about it early in the process. It's not like, oh, we're going for FDA approval, and you're like, oh, we're done. You're like, not even public. There's still a long ways to go, but you have to have your publication strategy. How are you going to work with the professional societies to influence the ANA eventually to get your codes, right? So there's a lot of different things that you can do, but it takes time. You can't show up at FDA approval and say, oh, we need a code. That's really difficult.
So thank you very much. I really, I think our breakout session are already working. So really thanks everybody for their time.